Okay, there you go. Good evening, everybody. Good evening. Thank you for joining us. We are a little late, very late actually, to no fault of ours. Unfortunately, I think you guys are all dealing with the load shedding at the moment. So thank you for everyone who has joined. And tonight's discussion is how to improve sperm parameters. And we are discussing this. We're chatting to Robin van Staden, and she is an embryologist at Genesis. So I know we're already late and everything, but I think it's a very good topic, and we're actually going to hear from somebody that deals directly with the, when it comes to IVF and dealing directly with the sperm. So more on the scientific side of things tonight. And it's great to hear from someone who's actually dealing with it and can give us a scientific aspect, or a scientific look on this, an understanding of it. So thank you for everyone that's joining us, and I'm going to invite Robin now. And let me just see. There we go. I'll invite you. There we go. Just give it a few minutes for Robin to accept. There we go. Hi, Robin. So tonight's been a bit crazy, but we did it. We're live.
We made it.
We made it. I'm sure there's a lot of people. I think it will affect also the amount of people that we're on tonight, because everybody's got load shedding at the moment. So I'm glad our turn is done for the evening, I hope. And I hope yours doesn't start soon as well.
Yeah, I'm supposed
So
to.
thank you very much for doing this, and being willing to discuss this with us, and give us more of your insight, a scientific insight on sperm parameters and that type of thing. So I'm going to get straight into it. What parameters are measured in normal semen analysis?
Okay, so when we do a classic semen analysis, we are going to check the volume, the consistency, the pH of the sample. Then obviously we're going to get it under the microscope. We're going to look at the concentration, as in how much sperm is there. We measured this by millions per milliliter, and to some of the newbies that come into the fertility world, they're always like, oh, it's so much. But
Yeah.
sperm is like wolves. They hunt in packs. You need a lot of them to fertilize an egg. So we look at that. We look at how many are swimming. We want to see at least 30% plus that are swimming. We want to see how many are alive. There will always be dead sperm in the sample, but ideally we would want more than 50% of them to be viable or alive. We also need to see the morphology of the sperm. So the morphology and the DNA content inside that sperm head are pretty much the most important factors, because we can work with low concentration and poor motility, but morphology and DNA content are really the most important ones. So I like to tell the patients that we check how many of the sperm are good looking. And the World Health Organization tells us we need at least 4% in a human sample that need to be normal forms. And it may seem quite low, but like I said,
Yes.
we're looking at millions per milliliter. So there are quite a few that will be good looking.
Yeah.
There are plenty other things that some labs may do. So they would check reactive oxygen species, they would test the fructose and the ejaculate and all of those things. It would depend where you go, and how advanced the center is, how many embryologists or andrologists they have, and the equipment that they have. And all of these things
Yeah.
can add value to your treatment, but they're not always necessary when we do a typical semen analysis. So that's generally what we're looking for when we do a sperm sample.
Okay. And so for those who've joined, because I see quite a few has joined while we're busy talking, Robin is from Genesis Fertility Center, am I right? and she's an embryologist at Genesis. So we're looking at more the scientific side of things tonight with an embryologist, and she's explaining about how to improve sperm parameters. So the next question we have is, what kind of abnormal values do you see most commonly?
Okay, so we have to bear in mind we are looking at a subfertile group of patients. So the most common abnormality that we see would be poor morphology, where we could have a relatively normal count, something above 15 million, and good motility, but there's poor form. So the head of the sperm could be like elongated, it could be too big, it could be too small, and that does impact fertility, fertilization, and embryo development. So morphology is really, really important, and it's very closely linked to, as I said before, the DNA content of the sperm head, which is vital in the entire process.
Okay. And then, are there treatments or supplements available to treat these different abnormalities? I think this is quite a big one because that's the first thing that gets asked, like what can I take to increase? And it's difficult to answer that with a lot of people, with a lot of clients.
So this is the biggest question is, you know, usually it will be the wife who says, my husband's sperm sample was poor, or this was wrong, or there weren't enough that were swimming. What can I do
Yeah,
about it? Can he drink this pill or that pill or the other thing? And there isn't really a pill that can fix something like that. There are supplements, and like any doctor will tell you, when you're trying to improve your health overall, it will always be the same thing. It will always be, a good diet, something, especially for sperm now, something that's high in antioxidants. So, he should eat a lot of food that's rich in zinc to help the prostate. He should, if he's going to take supplements, he should look for something that's containing selenium, vitamin C, vitamin E. Um, I think coenzyme Q10 is a new one that they've seen actually does help improve the volume, which in turn will improve the amount of sperm that we have to work with. So
yeah,
there are things that can help, but they won't make a drastic change. So if you've got someone who's got a very, very low count and a very poor morphology, it's not necessarily going to overnight increase all of these things, but it can help. So there's no harm in doing these things, but there is not really a lot of scientific evidence to say that, if you drink vitamin C, your husband's sperm is going to turn into these little supermen. It just
yeah,
it just doesn't work like that. Your genetics are what they are. Of course, there
yeah,
are surgical interventions if there is a problem. So
yeah.
if we have an ejaculate where we say, okay, there's a lot of elongated forms and poor morphology, DNA damage, then
Mm,
your fertility specialist might say, look, this is something I really think your urologist should address. He would do a physical exam and he may discover something like a varicocele, which would
yeah,
increase the pressure in the testes, it would increase the temperature in the testes. So it may affect the morphology and it may affect the way that the sperm is swimming. And it can be treated relatively easy with surgical intervention and those kinds of things. So there is treatment, there are ways to improve it, but there isn't something that's a miracle cure. And we all
yeah,
wish, I could just drink a pill and then everything would be okay. It is
yeah,
unfortunately not that simple.
yeah. You know what? Today alone, I had two calls from men asking about, where can they go. The one was asking about where can they go to actually have um, semen analysis done, and the other one was someone asking what they can take. But what I'm getting from this is more and more men are coming forward, where it used to be that, men won't come forward, they won't speak about it or ask about it. And funny enough, it is which I'm very proud of, is in the African culture. I'm so glad that men are actually stepping forward and actually saying, okay, what can we do to help the women? It makes me feel so good. And I actually, I really try and I'm going to help this. I want to help this person because it's for a man to step forward and say, I think there's something wrong, or can you help me? Because
Yeah,
he's helping his wife at the end of the day,
yeah,
you know.
it's a team
So it's
effort.
really, really nice when getting that.
Yeah, I think a lot of the time, the men, it's a lot to do with, and I want to say the word ego, but I don't want it to sound like ego.
Yeah.
But it is a big thing for them to,
Yes.
get these results and think, oh, well, there's something wrong, or it's all my fault. And, it's,
Yeah.
it's a big deal for them. But, the woman also goes through so much. She has to do all these injections and have all these horrible scans and these needles
Yeah.
and, the extraction and everything. It's really quite traumatic. And there
Yeah.
are things that the men can do. I mean, obviously support their wives, but, when the wives say, look, I really want you to stop smoking or drinking so much, or can you drink this vitamin C pill, or these funny things that will increase your sperm count, doing those little things, it may actually work magic for for the woman's psyche as well. It really helps.
Yes. Awesome. Okay, there's got another question is, how do you attain the best possible sperm when you have a sample with these abnormal values?
Okay, so luckily in the lab, this is the reason we do what we do. We do have different techniques, different things that we can use to help us when we have these samples. So obviously, if we're doing IVF, we're using a good sample. But if we need to turn to ICSI, then we need to use other methods. So if we have a patient that has poor morphology and possibly also a high DNA fragmentation index or DNA damage, then we're going to use something like a pixie dish, which some labs use. Some labs prefer to use something like sperm slow, it's a media, and it's actually quite cool. It's got hyaluron in it. So what that does is the sperm heads have receptors, so they get stuck in it, and then it's quite easy for us to go and just select the sperm that's been stuck, because we know then that it's the most mature and should have the least DNA damage or strand breaks in the sperm head. And that's really beneficial, and it has been shown to result in improved fertilization and embryo quality. So what's also really great about eggs is that in younger women, they have a much better capacity to correct sperm with DNA damage. So even if your embryologist isn't always getting the perfect sperm in there, the egg is also able to do a whole lot of magic on its own. So we wash sperm a certain way, we select sperm a certain way, and then the rest we have to leave up to the egg. And then we just hope for the best. We can't, I wish there was a supplement that people could drink just to make the DNA fragmentation or the reactive oxygen species go away, because those things have a big impact in the treatment and in the embryos.
Wow. I like making jokes. So anyone that knows me, I can talk a lot of nonsense. And as you're talking, I'm hearing you, I'm thinking, even as a tiny little embryo and a tiny little sperm, the women are still the women are still actually in charge and helping the men find their way. So I know maybe it's a funny thing, but
No,
I mean,
mean,
look at that. Like
it goes
an
back
egg
that
is actually
far. It's
helping
like
the
natural
sperm.
instinct.
Wow.
Yeah,
That's actually so
but by
awesome.
nature, women are always, yeah, we're just
Sorry?
always fixers. We like to fix
Yeah,
problems.
yeah, exactly.
Yeah.
Okay. So tell me, infections and antibiotics, how could that affect your sperm, a man's sperm?
Infections, antibiotics, they can definitely impact sperm quite drastically. Obviously, if a man's had
Yeah.
an infection recently, the most important thing is to determine, did he have a high fever? Because this is now seriously going to impact his sperm. It can decrease the
Oh,
concentration, the motility, meaning the amount of sperm that's available in swimming, and it can also impact the morphology. So if a
mm,
man has had an infection, we need to say, okay, it was a bad infection, there was a fever, where was the infection? Because if it was a urogenital something down there infection, we definitely have to wait this one out. Now, the biggest thing with sperm is it takes time. It takes time. So
okay.
we have to wait out the whole process of going from, the whole production of sperm. So that's about 120 days. It's 3 months, which is difficult because nobody wants to put their fertility treatment on hold, but it is beneficial. So then we need
Yeah.
to wait. We need to wait for a new regeneration process, for there to be fresh sperm available that hasn't been affected by that infection.
Yeah.
In the case of antibiotics used to treat an infection, it also has an effect. If there was antibiotics specific for the urogenital tract, then it would have been quite strong antibiotics. So again, it can have a serious effect. Antibiotics containing stuff like tetracycline are also quite toxic to sperm. So again, we have to wait 120 days for new sperm to be produced. And you could do a cycle before that time, but it is likely that you won't have desired outcome. You may have a poor cycle. So we want to avoid that. And we understand that patients don't want to wait, but at the end of the day, it may be worth it to wait. So big effect. And the hardest part of hearing that is that you have to wait 3 months before you can do anything again.
Yeah. So actually, it actually answers one of the questions that I had now is women are always saying, oh, let me abstain for at least 2 weeks before we plan anything, before it's that time, before it's ovulation and things like that. But it doesn't really matter because, as you're saying, it takes 120 days.
Yeah, so the abstinence is another thing. 2 weeks would be a little bit long. So the World Health Organization says to us that the sexual abstinence should be ideally no shorter than 2 days and no longer than 7 days. If we go shorter, then we may get a very low concentration, and that's fine in men that have a good sperm count. But if there is a slightly lower sperm count, we want to give them about 3 to 5 days abstinence and then to produce the sample either for analysis, for freezing, or for treatment. If we go longer than 7 days, then we risk a high percentage of dead sperm or a very low motility, which is not great. Again, if he has a high sperm count, it should be fine. But if his sperm count is on the lower end and he's got some abnormalities, then we don't want to really test that. We want to stay in that window.
Okay. We've got a question from Nikki. Oh, sorry. Lexi Brown, and she's saying my husband's count was 245 mil and mortality is 70%, but fertility doctors advise to take sperm. I approve because he smokes. Is there any other vitamins he can use? He hates pills and we're planning IVF. Maybe you can run through the list of vitamins again that you spoke about.
Okay, I'm just losing you a little bit there. I can see the question.
Yeah.
I think it's a sperm supplement or something. Is there anything he can take? Okay. So if your husband doesn't want to take a supplement, then still those general guidelines that I spoke about that any doctor will say to you would be, regular exercise. Obviously, everyone's going to tell him to stop smoking. Unfortunately, it does have a huge impact on sperm. Drinking as well, if it's moderate, it can still impact the hormones in both the male and the female. So drinking, not great. Not everyone's going to be a fan of that, but in moderation, it should still be okay. Definitely, you got to stop the smoking or at least try and decrease it as much as possible. And then just, try and introduce, if he doesn't want to drink pills, introduce foods that are rich in minerals, in antioxidants. Try and get him to cut down his coffee intake, maybe convince him to have a cup of rooibos tea every now and then, and those kinds of things.
Awesome. That's a great one. I just want to check if there's anything else. There's no one else. So thank you very much, Robin. I think you answered quite a few really good questions tonight. Again, apologies for everyone for being late because of load shedding. Unfortunately, we couldn't help that. But thank you again for doing this with us tonight.
You're welcome.
Thank you very much, Robin. Bye.
Bye.